Hi, and welcome back to Connect with MOBEC, the video series. I'm Jay Shubrook, professor and diabetologist at Touro University, and today's topic is 5 more things we want you to know about your diabetes. As you remember, we did an earlier topic about 5 things that our healthcare team wanted you to know about diabetes, and of course we have more. So we'd like to share these with you today. First, give it to me straight. I know that it's really hard to manage your diabetes. It takes a lot of work and things are not always going to be perfect, even when everything's lined up together. So it's okay to have setbacks. It's okay to not do everything perfect, but I want to make sure I know what you're doing so that I can best help you move forward, take more control, and make it easier for you to manage your diabetes. Remember, we're a resource to provide you with tools and information just to make it a little bit easier to manage your diabetes. And when you have setbacks, we'll be there for support. We'll be there to help you get back on the trail, back on the bike, whatever that is, get you back going on the road again. And we're not going to judge you. We know that it takes work, and we know that we're all human. So let me help you. Second, we've talked about this earlier. Lifestyle changes can be as strong as some medications. Many people with diabetes feel overwhelmed by the number of medications they have to take. I get it. It's a lot of medications, and those medications don't always make you feel good. So the more that you're able to do, the less medications we have to use for your diabetes. So that can be as simple as finding ways to get physical activity every day, maybe taking walks after meals, making sure that you eat in the healthiest way that you can afford and that can help you manage your diabetes. Filling half your plates with fruits and vegetables, or particularly vegetables. Making sure that you're checking your sugars and finding ways to reduce stress, get a good night's sleep, and take care of your overall health to make it easier to manage your diabetes. So remember, you have control over this diabetes as well. Diabetes is a progressive disease. And so while we do a lot of work for diabetes, it's normal for this disease to progress over time. So it is important for us to remember that, one, when the disease progresses, we need to progress with it. The treatment will go with it. And two is that so much has changed with diabetes. Please make sure that you utilize diabetes education so that you can have the best tools available to manage your disease. As we know, things have changed just even in the last 3 years for your diabetes management. And so being in the know is going to allow you to take control. Make sure that when you check with outside resources that you also check with your healthcare team. As you know, there is so much information out there. Some of it is really good, some of it is not accurate, and quite honestly, some of it's downright dangerous. And so your health is so important to us. We want to make sure that if you're out there looking for more information, which I think is wonderful, try to go to reliable sources such as the American Diabetes Association, or organizations like that. Make sure that when you do get information, bring that information back to the office. Share it with us so that we can also give you feedback on it. Some of this will be really interesting and some of it might be new to us. And so, it's helping us help you, but it's also helping us help other patients. And so share that information, make sure it's safe for you, and make sure that it's part of your treatment plan. And then finally, we want to be a resource for you. We know that diabetes is largely self-managed. More than 95% of the work of diabetes you're doing. We give you information. I might see you 3 or 4 times a year. So I know that it's very important that these visits be targeted to help you manage your diabetes. So we want to be that resource that gives you information and gives you tools to make it easier to manage your diabetes. I know ultimately you have to manage your diabetes, and so I understand that that work is the hard work, and we just want to make it just a little bit easier. We hope you've enjoyed this presentation. For more information, please visit our website and our social media at Facebook, Twitter, Instagram, and if you have any questions or comments, please leave them in the comment section. We'd be happy to continue this dialogue. Thanks again. We can't wait to get back out in the community working with you. In the meantime, we will continue to be a resource for you. Thank you very much.